Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, April 14th. Joining us today are the Chief Medical Officer of Health, Dr. Brendan Hanley. We have with us Mary Thiessen, who is doing our sign language interpretation, and we are also joined by André Boursier from the French Language Services Directorate, who will be providing French translation as required. As previous weeks, today's briefing will look slightly different, and Dr. Hanley will be taking us through a technical briefing on a variety of matters. Following the briefing, we will go to questions from reporters on the line. We will call you by name, and you will each have 2 questions. Before we begin, I would like to ask if everyone can hear us. If any reporters are having problems with hearing, please contact ecoinfo@yukon.ca. Dr. Hanley?
Thank you, Pat. Good morning. Bon matin. As Pat says, with our continued different approach over the last month, today's briefing will also be different in a number of ways. And keeping in mind that we are still currently in what's called the caretaker mode until all the new members of the Legislative Assembly have been sworn in and new ministers named. So today, I want to walk us through a review of variants and vaccines and risk, and as well as our usual case update. And I will be using some slides, which I hope will provide a little bit more visual context to the briefing today. And of course, we remain quite fortunate in Yukon with our current progress in the vaccination campaign and containment of cases. And we continue to push forward and remain steady in the midst of this pandemic. First, a case update. Since I was here last Wednesday, we have had now 2 new cases. Cases 75 and 76. 76 new since today, plus 3 public notifications recently, which have been already published for the 2 air flights into Yukon and some businesses as well. So these 2 newer cases are part of a family household cluster within a household and linked to a family group that traveled in from out of territory. From the beginning, we suspected that this might be a variant, and we have treated this as a variant from the first that we heard about the case. And as of last evening, this was confirmed as clusters reflecting variant COVID. And specifically, this is the P1 variant. So these are our first cases of P1 variant COVID-19 in Yukon. All of our recent cases then, whether the out-of-territory cases that we've recently talked about in the last 2.5 weeks or so that are visiting here, or Yukon residents who have been exposed out of territory, have been variants of concern. And of course, if we look back over the last year, the vast majority of our cases to date have been acquired either from travel or linked to someone who has traveled. And through the last year and beyond, I hope for the time that we see ahead of us, we have avoided, and I think we will continue to try to avoid community spread of COVID-19. Now, a bit about the P1 variant. There is relatively little known about the P1 variant compared to the others, and we're learning more every day. This is the variant that was originally associated with Brazil, but has appeared in many provinces now in Canada. So we're obviously concerned about P1 coming to Yukon. It is concerning, but it is a variant, and like all variants, and I'll talk about this a bit more later, the same public health measures work for variants that works for the everyday COVID that we've been experiencing over the last year. So back to a bit of an overview. And so I'm going to stay with this introductory slide for a while I just talk about this overview. I think we have to recognize that our successful efforts have been due to a combination of strategies. Much credit has to go to all of the Yukoners who've actively supported and followed the public health guidelines, and that's been our key to success. In Yukon, we've also had the good fortune to remain moderately open, while we have had to watch our friends and family in other parts of Canada re-enter lockdowns and undergo newly imposed public health measures. And as the variants spread and cases surge in Canada, I'm sure there are those who wonder if these more restrictive measures will come here. Well, all depends on you and on what is to come. We do have plans in place for what to do if things get worse. If we were to see a large increase in cases, if we started to see hospitalizations and community spread, we may have to take additional steps. And of course, along with public health measures, vaccines remain our best way out of this pandemic. When it comes to variants, we still need to do more. The early evidence is that the Moderna vaccine has good effect against the B117 variant, but we know less about the vaccine's effectiveness against the other VOCs, including the P1. Our vaccine progress, I'd say, is admirable. We have officially provided, as of yesterday's tally, 24,762 first doses of vaccine and 18,095 second doses. Our vaccine teams have just completed their third visit to all the rural Yukon communities, and even with that third visit, providing more first doses to Yukoners. To date, locally, there have been no confirmed serious adverse events related to the Moderna vaccine. We are aware of some minor reactions, and all have been reported as usual to the Public Health Agency of Canada. I know that there are at least 2 individuals who have publicly reported severe reactions, so I wanted to just talk about that for a little bit. Of course, we take reports of serious adverse events very seriously, and we try to ensure that people report vaccine reactions that for them are unusual, unexpected, or severe. Now, with immunizations, we've always had a system for reporting vaccine reactions, known as APHEs, or adverse events from immunizations. The nurses who run the vaccine program collect the information from any adverse events, work with physician advisors, review the documentation, and then report it up to the Public Health Agency of Canada. At that table, a so-called causality analysis is carried out to figure out if the vaccine may have played a role, or if the timing of the vaccination was a coincidence and the event would have happened due to other reasons. So, of course, there's a limited amount that I can say about individual cases or the actual diagnosis. But I do think it's important to say that what you may have heard with respect to vaccine reactions have nothing to do with the rare thrombotic or clotting events that have recently been attributed to the AstraZeneca and more recently the Janssen vaccine. And of course, we heard about the first Canadian attributed case of this just in the news today. But we're not hearing those signals with the mRNA vaccines, including Moderna. So I would say that nothing about these particular cases makes me more concerned about Moderna vaccines. And now, after literally millions of these vaccines, including the Pfizer and Moderna, distributed and injected around the world, they're certainly showing to be remarkably safe as well as effective vaccines. So we've reached in the area now of 70% of Yukon's eligible population having had their first dose, around 49% of the population having received their second dose. These, I guess the next slide might have the actual numbers, but the numbers that I read out to you earlier are the numbers as of the end of today anyway. So when you think of that many people vaccinated within our territory, it truly is an astounding accomplishment for the territory. At the same time, it isn't yet where we need to be. This COVID virus has never been too forgiving, and the variants even less so. So after a rapid upswing in vaccine uptake in the first few weeks, the progress for first dose uptake from day to day is slow, but there is progress, and I'm very grateful for that. So you now see 54%. I think a week ago I said 53%, and a week before that 52% when we were talking about first dose uptake in our younger adults. So this is the breakdown by age group that you can now see in front of you, hopefully, that I've been talking about over the last couple of weeks. And if we look across that span then of the vertical bars, as I mentioned last week, vaccine uptake by age goes down with every decade. So if we look to the right, the 70 plus, that's the highest bar, now at 88% uptake. Fabulous uptake. And then we see that there's this decrease towards 54% in the youngest adult age group. So I think this, hopefully this paints a kind of a picture of the proportion of the population that is still not vaccinated and vulnerable to the virus. So if we combine that 46%, still almost 50% susceptible younger adult population. And then we think of incoming newer people who may not be vaccinated. And then we think of the 20% of our population that is below age 18. That means thousands of people still susceptible. Enough of the population, therefore, non-immune, where COVID-19 could easily circulate and cause harm. And with variants, of course, that threat is more pressing just because of the increased ability, the transmission ability that variants have. So this is a little more on variants. And we know that the variants of concern, or VOCs, are set to dominate COVID activity in most of Canada. I know only a few months ago it felt that we were really turning a corner in this pandemic, but variants have definitely disrupted our efforts. It's as if someone keeps adding corners to turn. And the variants of concern are growing swiftly, as are the number of cases, hospitalizations, and ICU admissions when we look across the country. Younger people are being particularly hit. Provinces that are aggressively trying to contain variants are reporting quite a substantial increase of hospital admissions of younger patients who require intensive care. So these numbers present the reality of how pernicious these variants are. Currently, it's estimated that 1 in every 3 patients hospitalized with COVID-19 will be admitted to intensive care. And if we were to take these numbers into consideration and measure if a variant of concern were to get out of control here in Yukon, the impact could be serious. We can see in this slide the number of variants that are confirmed throughout Canada and the number of variants that are screened, also known as presumptive variants. These are, so you can see, Ontario, Alberta, British Columbia, Quebec, Saskatchewan principally. So the confirmed numbers, though, go up literally daily. Canada surpassed 40,000 cases of variants of concern and over 5,000 in BC alone. So if we were to open the lid and allow COVID-19 into the territory without measures in place, we could lose control. We cannot yet rely just on vaccination. I know pandemic fatigue is very real after a year and more. And with case numbers being so low in comparison to other areas, it's easy to think that we have nothing to worry about and therefore to let our guard down. But I can't stress enough how important it is now that Yukoners continue to follow our current measures. So this is a picture of our Swiss cheese model, which I'll explain, and a frequent topic of conversation is self-isolation, and when can we move beyond self-isolation? Why must we self-isolate if we're vaccinated or even if we aren't? So I want to talk a bit about how self-isolation has been such an important tool in maintaining our low case count and has allowed us to live in a relatively open society. We often talk about importation risk. That is, what is the risk we are facing of COVID being carried in by people crossing the border? And that risk has been high with every surge of COVID activity we've seen in Canada. And it is quarantine or self-isolation that has kept infected people from spreading COVID infection to others. So this Swiss cheese model it's a good representation of how public health measures and vaccinations work together with one another. This model likens all COVID measures to multiple slices of Swiss cheese stacked side by side. And each hole we see in the cheese represents a weakness in any individual part of our current measures, because every slice has its weaknesses. It has a leak, as it were. So the risk of any one hole could be leading to COVID infection entering is reduced by the lack of that hole lining up in the next one. So that even if you see on the left, you see that rod going through 3 holes in a row, but then it stopped. So that's the kind of the concept, that each layer has leaks, but when you stack up multiple slices, you get that you get that protection of multiple layers. So what does this mean? It means that no single measure alone will protect our population from COVID-19. And it attests to how well our public health measures work together, hand in hand. So once we ease certain restrictions, we're creating more holes in our layers of protection and ultimately increasing susceptibility to COVID-19. For people who have received first or second doses of vaccine, they may feel the holes don't matter anymore, but they still may, given that we don't yet know how long the vaccine will last. We don't know how well the vaccine works against all the variants, and we know that with 90 to 95% real-world effectiveness, which is amazing, that means 5 to 10% of the time the vaccine may not work. So even vaccine alone may not be a sufficient layer of protection, at least until our population has a uniformly high uptake, until our kids get the chance for vaccination as well, and until the risk of importing virus from across the border gets back down to manageable levels. Now, that doesn't mean that self-isolation will be permanent. Changes will be coming, and we are planning possibilities as we speak. At this time, we're not yet confident enough to feel that a sufficient majority of Yukoners are protected from COVID-19. Our border measures are critically important in slowing the spread of any new cases or importation. But we are exploring some options of how, and when appropriate, and when safe to do so, we could lift or amend the self-isolation requirements. We've also been asked why we can't reduce the self-isolation period for those who are fully vaccinated and can show proof of a negative test result. And this is a great question. And believe me, we and many other places and people are exploring how this might work. The first and best methods to preventing transmission and preventing infection with COVID-19 are vaccination and keeping infectious people away from others through self-isolation. So testing can help, but it's clearly not a sufficient method entirely on its own. And there are a number of factors to why testing is not perfect and may not provide the desired results. One of the reasons that testing is not a foolproof strategy is because the risk of transmission is not constant throughout the duration of infection. So, with apologies to Tim, who I presume is on the line, this is a fictitious Tim that we're going to talk about to illustrate why we just don't test everyone coming into Yukon. And there are some reasons why, and I hope I can clarify that. So on the slide, you see this visual of Tim, and let's say that Tim took a visit outside somewhere, maybe even for an essential reason, spent a few days in Vancouver, for example, and returned. And let's say he was exposed to COVID while at a small gathering a couple of days before coming back. He's nervous about it, and he arranges for a test the day after he returns to Yukon. On the day of the test, he has no symptoms. He ends up receiving a negative result. So Tim returns to daily life and works as usual. By day 8 after return, he starts to get a tickle in his throat, a dry cough, and then begins to run a fever. He has the wisdom to get tested again, and 2 days later, he receives a positive result. Now, since going to work and hanging out with friends, Tim was infectious, even though he only began experiencing symptoms 8 days after infection. I use this example to show potential pitfalls of over-relying on testing. Now, there are many ways to run testing programs, such as testing on different days, with some degree of self-isolation, but some degree of self-isolation is also generally required in order for that to be effective. Clearly, testing can be useful, and I'm talking here about asymptomatic testing. And it might in the future play a more prominent role in how we screen for COVID upon entry into Yukon. But whether we test at day 1 or 5 or 10 or all of those, there will be risks of missing true infection or diagnosing infection when none is present. Testing takes time, interpretation, and resources. As we continue to reach high vaccination levels in Yukon, testing could play a more useful and manageable role in screening for COVID when the consequences of a missed case of COVID are reduced because there are less susceptible people to infect. And this is part of the work that we're presently doing to see what the options are for government to consider when the time comes to relax current quarantine requirements. But now is not that time. For the time being, everyone entering Yukon, whether for the first time or returning, is required to self-isolate unless deemed under CIMA a critical worker. With university semesters ending shortly and students who are away returning home, this is a good time to remind parents and students themselves that they also will have to self-isolate for 14 days upon return. Many are coming from areas where variants are spreading rapidly. Many are coming from lockdown areas. We need to ensure that we limit that risk, not just of introduction, but of possible spread. We know that variant COVID disease spreads extremely easily through a household, even when people think they are living separately and doing the right thing. For the time being, as we see variants rising dramatically, I want to offer the following strong recommendation. Everyone returning from travel outside of Yukon, of course, must self-isolate. If you are self-isolating in a house with others, I recommend that household members should self-isolate with the travelers for the 14 days, which means not going to work, going shopping, or mixing with the public. And when that's not possible, please be extra vigilant around household members. Maintain at least a 2-meter distance, wear a mask, wash your hands, clean all shared surfaces several times a day. Do not eat meals together. Do not be in common areas without masks. Do not share serving utensils. And we are looking at more information and advice specifically for returning students and parents and incoming seasonal workers to be available by next week. So I know we never thought that this pandemic would surpass 12 months, but here we are. And although I wish we could, we cannot predict what this is going to look like in a few months or even in a few weeks. as the virus does continue to go through quite drastic changes. And of course, that part is beyond our control. But even with today's news, though it may not always seem like it, we are in a good position. And while others are locking down, we are having these conversations and looking forward to when we can begin to lift some restrictions. It's been an incredibly long road, and I know people are tired, but we need to keep finding within that resilience and strength to keep moving forward, as this will keep Yukon in a place where we currently are. And that's my update for today. Thank you. Merci. Guanastish. Nasicho.
Thank you, Dr. Hanley. We'll move now to the phone lines, and we'll begin with John, CKRW.
No questions. Thank you very much.
Thank you, John. We'll move to Philippe, CBC Yukon.
Yes, thank you. I wonder, what is the latest science
You have reached the recording
on
limit.
surfaces? We see many businesses are still disinfecting surfaces. People still might be washing their
To
groceries.
record some more, press
What would
5.
be your advice
To review your
when it comes to
message,
cleaning
press 2.
things?
We're getting some feedback from someone who is on a different line, so if I can ask folks to please mute their lines. And Philippe, if you could repeat your question, please.
I can, maybe I'll repeat Philippe's question because I heard it quite well. Philippe was asking about what is the science telling us about surface contamination with COVID, and what does that mean for things like washing groceries or maintaining surfaces? And I think the science has come some way, and it's not all in my head. But I think what we find is that COVID virus, like other viruses, can linger and last on surfaces. It's not to the extent that I would be worried about groceries and washing groceries. You know, things that are transiently touched or possibly touched by others in a common setting. So I think just the normal hygiene in terms of things that you carry home from a store, whether that's a package or your groceries or letters from the mail or anything like that, really just with general household, clean household and general hand washing, that is sufficient. Washing your vegetables as you always do, anything like that is the usual. There needs to be no extra measures in light of COVID. It is important, though, that that in any public settings, that and that includes workplaces, anywhere where there's mixing of people, that we be very conscious of the potential role for commonly touched surfaces. So if someone were infectious, infection can be carried through fomites or through basically dried droplets, hands, and carried on the hands. So that's where things like something that you might carry and give, a phone, a door handle that you open, a desk area, a table, a meeting room, a lunchroom table, a meeting room table, anything like that where there's frequent touching through the day needs to be regularly cleaned. Doesn't have to be anything, again, normal kind of household cleaners. It's really just a matter of that frequent cleaning rather than special agents. So I think that's more or less it. It's mostly kind of common sense, but paying attention to that regular custodial care of frequently touched surfaces and areas.
Thank you. Philippe, do you have a second question?
I simply would ask as well, what is the latest on non-emergency medical procedures for Yukoners? Are they able to leave the territory, or have we seen those procedures delayed? Thank you.
Yeah, thanks for that question. So now there may be individual areas where there have been delays or backlogs. So I can't really speak specifically to that because I don't have that information. But medical travel is definitely still occurring, and now a lot of that again has been occurring, at my understanding, remotely or through through Zoom, just as it is locally for primary care. A lot has been happening by phone and by video and by remote technology, such as Zooms or others, and a lot of that is in order to facilitate the spacing that is required within medical clinics. So, in order to attend to in-person care and observe public health cautions, it has affected some of that clinic flow, but the care has been happening virtually. As well as online. So I think to some extent that's happening with specialist care as well when it's out of territory, or whether that's even rural care from specialists centered in Whitehorse. So a variety of mixes, but yes, medical travel is still definitely happening. Of course, when people go out for medical travel, they also need to plan for that self-isolation requirement when they take back, and that needs to be factored into the booking.
Thank you. We'll move to Tim, Whitehorse Star.
Yes, good morning. I think I only have one question. It'd be for Dr. Hanley. Did you narrow down at all even a general location for these Brazilian cases of the variant?
So I think if you're referring to where the origin was, we don't disclose jurisdiction when we have cases that are imported, as it were, and they belong to another jurisdiction. We don't announce the jurisdiction of origin. Of course, I do know where this family came from, but it's not a jurisdiction that we disclose just for confidentiality reasons. And they're not our cases, as it were. They are cases that are counted, but counted in another jurisdiction. But they do come from one of the provinces where P1 is known to circulate.
Do you have another question, Tim?
Yes, that wasn't quite my question, although I appreciate the information. I'm just wondering, this is a family cluster, so where are they located in general here in the Yukon? I don't think that was pinpointed, unless I missed it.
Okay, sorry if I missed your question. So as you know, we disclose if cases are in Whitehorse or in rural Yukon. In this case, these people are in Whitehorse.
Okay, we'll move on to the reporter from Radio-Canada.
Oui, bonjour. Dr. Hanley, est-ce que je peux vous demander d'expliquer en français pourquoi l'avancée de la vaccination, ça va pas forcément signifier la levée des restrictions à la frontière, par exemple?
So, Dr. Hanley, could you please explain in French why the progress we're making with vaccination will not necessarily mean a change in the restrictions and the recommendations that you have made concerning COVID-19?
Oui, merci. J'ai expliqué en anglais que on attend toujours de progrès avec la taux de vaccination. Et la taux de vaccination, même que c'est formidable et on a un grand succès jusqu'à maintenant avec une taux de 70% pour la population adulte. Ça laisse toujours des gens qui sont susceptibles au COVID, et surtout chez les jeunes adultes, et avec 46% des jeunes adultes qui ne sont pas encore vaccinés. Ça, c'est entre 18 et 29 ans. Et que même que la taux, ça monte avec chaque décennie d'âge, c'est toujours moins que le taux maximal. Même qu'il n'y a pas une cible ferme, on veut voir que la taux, que c'est plus ou moins égal chez tous les groupes d'âge. Donc, si on avait, par exemple, 75% ou moins ou plus pour chaque âge, ça serait plus rassurant du point de vue de protection de la communauté. En plus de ça, on a tous les gens, à peu près une vingtaine de pourcents des gens qui sont moins de 18 ans, les enfants qui sont pas toujours approbés pour recevoir la vaccination. Donc, ça nous laisse avec la possibilité d'avoir le COVID circuler dans la population si c'était importé, surtout avec les variantes. Donc, c'est un but, c'est pour reconnaître qu'avec le vaccin, on va être équipé de finir la pandémie quand on arrive à être vacciné. Et on est en train de faire beaucoup d'analyses et de planification pour le futur avec une population vaccinée. Donc, dans ce temps-là où on essaie toujours d'encourager les gens d'être vaccinés, on fait les plans pour les prochaines étapes quand on a un bon taux de la population vaccinée. Et quand on est à l'autre côté de la vague de COVID-19, de COVID-19 qui circule dans le reste du Canada.
Avez-vous une autre question?
Oui, merci. Merci pour cette réponse. Une petite question par rapport aux élections. Pouvez-vous expliquer, toujours en français, comment change le processus de décision concernant la COVID en attendant le nouveau gouvernement?
So could you tell us exactly in French how the situation with the elections in the Yukon is changing the process to make decisions in terms of restrictions or otherwise?
Oui, je vais essayer d'expliquer que on est dans une forme de gouvernement qui est entre deux gouvernements. En fait, on attend que on a des nouveaux ministres et un assemblage. Avec un vote pour avoir un gouvernement qui peuvent prendre les décisions. On a beaucoup de décisions qui sont pas les décisions de moi, comme dans mon position comme hygiéniste en chef, mais qui sont les décisions d'un gouvernement. Donc, on attend ça pour les décisions importantes pour les prochaines étapes. Ça nous laisse toujours la possibilité, si on a les moyens pour continuer toutes les fonctions de gouvernement journalier, et c'est sous la direction de sous-ministres pour la plupart. On a toujours les moyens de rassembler, selon mon si je comprends bien, de rassembler les ministres si on avait une situation urgente. Donc, toujours on a la capacité, s'il fallait faire les décisions urgentes, on pourrait faire. Mais si on a des décisions qui ne sont pas pressées à faire demain, on attend le processus normal, on attend les nouveaux ministres, les nouveaux gouvernements. I'm just really reiterating some of the aspects of a caretaker government. Just, excusez-moi pour traduire en anglais. I'll just to explain what I was saying in French about how a caretaker government works. It's really that we are, when there are significant decisions that a government needs to make, such as that might be around public health measures, although they are usually based on recommendations from me in my position, they are nonetheless government decisions. So those are those sorts of decisions, like changes in public health measures, usually will await the swearing in of a new government, where they've had a chance to have ministers sworn in, and they've had a vote in the Legislative Assembly. So that's the kind of the process. We're in that in-between stage, where the deputy ministers make the kind of the day-to-day decisions to keep government running. It does not mean that if we needed to make an urgent decision tomorrow, that we don't have that capacity. We do have that capacity to bring together deputy ministers and ministers and even cabinet if necessary because of an urgent change in situation. But otherwise, we wait and bring forward recommendations to the new government when it's sworn in.
Thank you. We'll move to Hanley, Yukon News.
Thank you. My question, I'm pretty sure I can read between the lines for the press conference, but I was just hoping to clarify the public exposures announcements that were made. So was that from a non-isolating household member who lives with the first case?
So, yes, correct. So the public exposures were, I guess if the question is, was a person violating self-isolation and that's why there were public exposures, the answer is no. It was someone that was not required to be in self-isolation. But there was a common, there was a setting in which we had evident transmission within a household despite best efforts to maintain self-isolation. So I think it points to the vulnerability that we do have, especially with variants, which is why we have been very cautious with our notifications here, acting in a very precautionary way, because we have seen this around the country. We have seen transmissions within households occur uniformly, very, very easily, with the demonstrated ability of these variants to spread rapidly, despite what appears to have been careful measures being taken.
Do you have a second question, Hanley?
I do, yes, thank you. Dr. Hanley, I was wondering, those sort of extra recommendations that you made in this press conference around taking more precaution when you're a non-isolating household member, going forward, is there any possibility we'll see it become a requirement for all members of the household to isolate if they're living with someone who is required to isolate?
Yeah, Haley, it is possible. We are looking at some options again for how we might tighten or recommend tightening of requirements. It is, I would say, not directly related to these recent cases. Again, we know that this is, as we see rapidly rising numbers in Canada, we know that our present, as I referred to earlier, our importation risk has significantly increased. That means the chance of someone who travels to Yukon being infected has gone up significantly with the surge in COVID activity, particularly variants. So we know that this is an ever-present risk. We also know that by and large people are being careful and doing the right thing when it comes to self-isolation. But as I've said before, variants are just non-forgiving, and if we can find better ways to guide and support people in doing the best self-isolation possible while we ride through this wave, then those are some options that we are currently looking at.
Thank you. We'll move to Beth, Canadian Press. And hearing nothing from Beth, I'd like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, April 21st at 10:30 a.m.